is. We got our superstar. Superstar. All right, so right out of the gate, you gotta take a look at me, guys. You can see, see how I've got my hands on shoulders. You see that? So automatically, I'm suspicious that there's something in through here, right? So most likely in through here. As we go in through here, we can go ahead and feel down here. He has a sulcus on this side. It's all heavy rotated posterior on this side, okay? So that's a key component. The other thing is we're also noticing right in through here, these scalenes are terrible. Posterior scalenes bilaterally, middle scalene on the right is terrible. Coming through here, a dip in here, it's got a dip in here, so that's good. So that shouldn't be too bad. However, it's a little higher in through here.
Is there any history that we should know of? Because it's shoulders.
Right shoulder surgery at 8 inches in my labrum. So that was 2012 when the chiropractic school I pulled out.
Oh, rugby.
I took cervical class like this.
Yeah, no way. So we also go ahead and look at his torso, right? And you know, obviously he's in great shape, okay? But you know, you're looking through here and you look at his torso. Is there any twist? Is there any rotation? Is his hip anterior on one side versus the other? Is there a tilt? What's his knee doing? Is his knee, you know, arching in on one side? Is there valgus in there? Is it varus in there? Is there foot out, toes in? You know, you can look at all of these things. Now, you're just basically creating mental notes, right? That's all you're doing, mental notes. See what's going on in there, all right? And you can choose to write it down or not write it down, you know? It's up to you. So thank you, sir. So what we're going to do is, I know your shoulders are the primary thing that you're looking at, but let's go ahead and look at the foundation first, okay? So let's go nose in the hole. Make sure you never ever move this around here a little bit. Make sure you never reach around. Because that there gets you up to clip your fingers. It's bad news bears, right? And then hands right here on that so I don't step on your fingers while we're going through it. Okay, so as we're looking in through there, toe in on this side over here. So left toe in. Okay? The other component in through there is I want you to go ahead and look at his calf, the tonicity on the calf on the right. Okay? I also want you to go ahead and take a look at what I'm seeing right here with his butt. Okay? You look right through the middle of his legs into his butt, and what do we have? We have a bit of what I would go ahead and call a left shift. Okay? So his butt is shifted to the left. So left hip, and then he also has a posteriority rotation on the right. Okay? So right post. All right, so all I'm doing is just seeing what we have in through there. We already know that he also has a right hump on thorax. So just right hump thorax. You also at the same time have right scalenes. Okay, so and then we also have right shoulder lobe. Okay, so you can throw all that stuff in there if you want to. That actually is an examination, isn't it? Right? Crazy as that seems. You all right, buddy? All right, so what we're going to do is we're going to go right in through here. I'm going to see what's going on. Okay, now, you see the sulcus, right? Come in through there. Is there a sulcus? There is here. There's nothing here. Okay? So, that's going to be right posterior. I'm pushing over here, and then I'm going to push over here. It sticks. It moves this way. So I'm going to go ahead and do left inferior, right? And left post. You see how that works? So what's going on, the sacrum's dropped this way and rotated this way. Sulcus on this side, no sulcus on the left. Okay? And then I went ahead and I challenged it to try and push it this way and move up. So it's dropped over here. All right, you with me? Okay. I'll goose him right here. Ischial tube. Ischial tube. Do you see the difference in that? And then you can play it just a little bit. And as you go ahead and you move it around, that comes kind of like it comes up. So it's an AS on that right side. Okay? So AS on the right, maybe an IN. See how that sticks? Okay? So I'm going to call that a right ASIN. Now, can I change my mind? Yes. All right? Because it's a yes. Could there be internal hip rotation that's locking pubic or the hip socket itself? Yeah, it could be all of that, right? So those things are problematic. So go ahead and raise your right leg up for me high as you can. Got it? And how about the other one? Okay? So what did we see? We saw ease of motion. Now, they could be exactly the same, okay? But one went up easier. So I'm going to call that out. I'm going to say that was an easy lift on the left. Now, does that mean the sacrum is going a particular direction? No, because honestly, what we just proved was, just by palpation, he's an SAR, which is completely the opposite of the leg he lifted easy. So the test that we taught in college made opposite confirmation with x-rays, and that's a different game. So we come in through here. So he's about a 1/4 inch short right. Bring him in here, and he goes a 1/2 inch short left. Okay? Now what I'm feeling as I go in here is ankles lock right here. Okay? So I'm going to write this down real quick because I will forget it, right? So 1/4 right, 1/2 left. So likely ankle on right. Just mark it down. Bring this in through here. Now I'm feeling his knee. So, medial lateral. Medial here. Lateral there. But both medial here. So what I'm going to call bilateral here and medial here. So bilateral right.
Are you talking medium prominency or?
Yeah.
Okay.
Yeah, come here, feel it. Feel the difference?
Yeah.
So what's happening is this tibia has rotated posterior on the medial side. You'll feel it? And then what I want you to do is I want you to feel the other side. The other knee. Do you feel that? Isn't that something? Thanks for being the fan.
You said left side is versus medial.
Yeah. But here's the bizarre thing. Is look at the feet too.
Doc, when you do the leg check, where do you when your hands kind of become the outside or when you're feeling the?
I'm just doing the standard, the standard. There we
How do you
go.
feel in the ankle or not?
Oh, yeah, I just feel the resistance. You go and feel it if you want to.
Let me see how you grab your feet. See if it's similar to my style.
So that right knee is really angry. Has that been angry for a while?
Yeah.
Yeah. So I'm taking it here,
Okay.
and then I come in through here. And you see how I'm here?
I got you.
So I'm see this ankle is a big piece of this, contributing factor here. Also feeling the knee on the right being a contributing factor, and then feeling the rotation in through here, right? So now at the same time, I didn't see his butt come up or do anything weird, right? But there's something to it. So we've already got this here figured out as far as what I think it is. So I'll go ahead and I'll come up to the top here as well. Come in through here, go in there. Now, I love showing this to patients, all right? So what I do is I put my finger in through here. I'm on the atlas on this side. There's the atlas on the other side. That does not feel even, does it?
No.
So basically, his atlas is all shifted this way, okay? Now, I'm just going to call that, I would quickly scan that and call that a left lateral. And then I would go ahead and come in through here, and there's the PR. So ASL, PR. And that's pretty much all the listings I need to know. It's pretty quick, isn't it? So it's a quick scan. Now, we already have talked about some of the things that are happening here. And, as we go along, you should feel this. Because this here kind of ties in with what we were talking about, just a little while ago. And you can feel how large the resistance is. He has a hiccup over here. Come over here.
You can see it.
Yeah, but can you see the spongy? So the rib cage isn't giving. And try it from the side. So come in through
Same side?
here. Yeah, so go same side. You feel how it's just, I mean, the whole thing is locked up. And then you feel this in here, and there's like a section. Do you feel it? Isn't that just weird? You know, you think about it. Anybody else want to feel that sponginess? You see what I'm doing, right?
Gordon, yeah.
That quercetin, have you had that? That stuff, I mean, it just constantly brings junk out of your lungs. Quecertin. Amazing. It's supposed to be good for immunity. Yeah, or quercetin, or whatever the heck you call it. So, you good? Go.
What's the biggest thing on your
They're all big. I've got Mark Henry on here. I mean, Colin Bryce is there, Lefa, Hathor, Eddie Cohn in here, Zydrunas Zaviscus. Yeah, I mean, anybody is anybody. I've got 4 tables. 3 of them are all tatted up, you know, with signatures. So yeah, the Tommy Stoltman, you know. I don't think Obi. I got a picture of me working on Obi though. Robert Oberst, who was in the pulling the trash can, the trash truck or whatever. Martins. So everybody. Yeah, it's so funny. I don't think about how blessed I've been. It's pretty cool. You know.
Do you get any competitors up at the same time?
Oh my God, oh yeah, absolutely. Yeah, people get on the table and they get treated on the table. Oh my God, that's the same table Eddie Hall was on. I go, yeah. Before he won World's Strongest Man, and before he did the 500 kg, and he signed it twice.
That's pretty cool.
Isn't that crazy?
So did we go back and sign with the 500 afterwards?
Yeah, he did actually. It's funny, you know. So, all right, are you doing okay? Yep. So what we're gonna do, we're going to bring this drop mechanism up. Got to tighten it up. You're a little bigger than Liv was, huh, buddy? That's good. Yeah. I'll take that right there. Okay, so what I'm going to do is I've got a left inferior, left post. There's a lot of ways of approaching it. What I'm going to do in this instance is I'm going to go ahead and contact it through here, and I'm going to move that this direction. So basically that's going to close this over here. So I'm going to move it this way. That's the goal, all right? So what I'm going to do is, and Anthony will tell you, hey dude, that's a lot of pressure. But you're going to see how I'm doing it, right? So it's a leverage component. The one thing I had to learn how to do when I'm working on 400-pound athletes is how to get the maximum leverage, you know, especially when each leg weighs about 150 pounds, you know? So a couple things. One, I'm going to bring his knee up here. You can ask the patient to bring his knee up. That's fine. Now, go ahead and relax your leg, buddy. Okay. You know how much work I'm doing right now? None. Because I've got him splinted. Okay? So all the weight is here. He feels relaxed. I'm going to get in there and get that joint, aren't I? Okay? So I'm going to hook in through here on the elbow. I'm going to move it from right to left. And I'm going to bring this up at the same time to scoop it to close this. Okay? So take that in through there. Probably felt a little release on that already. Oh. Did that look like a lot of power? Did that feel like a lot of power?
Like a lot of power, yeah.
I was like, don't do that again, right? And so now what I'm going to do is I'm going to come over here and I'm going to show you how to get the posteriority aspect out of it. So this time I'm going to ask. There it is. So, you feel how the knees have let go? I mean, you can't even make this up. So, if you had to take this and you apply this to other athletes, like you with the skaters, for example, you know, in hockey, is this valuable? Yeah.
It's good.
And it shows the power of a pelvic adjustment. Is that cool, Spence? So, here's the neat thing, okay? Now I don't have to go in there like a wild man and try and, you know, bust stuff up so good, so bad. But even the rotation in here is minimal. So, what I'm going to do is I'm just going to go ahead and block them up. Here, let's bring your hip up here a little bit. Thanks, buddy. And then I'm going to bring this up a little bit. So, while he's in position, there we take that finger right there, we'll go on the tip, okay? We'll go on the tip, we'll bring this in. See how I'm moving the foot? I almost do, there's so many of these things I do automatically, I don't even realize I do it. I just reset that. You feel it now? It feels balanced. It feels solid though. It's different. The idea is the reorganization. You feel what I'm talking about when I say it feels solid now? What do you think?
Fibula still feels a little different.
They may, yeah, they may. So it's steps, right? So what I'm going to do here, this feels tremendously better. So this one is more out here, it's more fit, right? But what I'm trying to do is I'm going to go ahead and make the whole knee move. Just like that. See how you are? All right, so I'm going to go ahead and finish this, and what I'm going to do with the finish is I'm going to go ahead and I'm going to open the knee up. Okay? Take that out just like that. How's the butt look?
Beautiful. Yeah, right.
It looks beautiful, buddy.
Right.
Woo!
Sculpted.
Sculpted. All right, so I'll just go ahead and I'll run through this, and then we'll come back. And, yeah, Georgie knows what we got to do. Yep. Georgie and I like doing this with a lot of the new doctors because they can see what we're doing. Turn your nose the right way. There you go. Good, yeah. There it goes. In center. Did you feel that to your chest?
Yeah.
That hasn't moved in a long time, brother. Now, remember the scoop thing that I was talking about? The roll? I'm going to take my finger. I'm going to roll it up. Do you feel that traction? Now, he has a big something going on here, which is counter to this, okay? Now, do you feel how much better that atlas feels? I haven't even touched it yet. NC2. So now what we're going to do is go ahead and have you turn your nose to the left. Best you can. Pull it back. Feel that sucker move. And then nose to the right. And center. So, put that in there. You feel how that left side tension is gone?
Yeah.
All right, we got something at 6. Imagine that. Nose to your right. Hang on. See this? Yeah. Yeah, baby. That's what I'm talking about right there. A little bit more rib stuff here. So, occipit's been not happy for a while. Has a traction. Okay, cool. So, what I did was take this, boom. So, held that, stabilized it, let the table do the work. So, let's go ahead and raise your right leg up. I should can, buddy. Gotcha. How about the other leg? Gotcha. All right. So, how are you feeling?
Good.
How's the speed going? Feel the balance? Remember how that was toe in? Okay, so this is all moving nice. Hi, Jackie.
Hi, how are you?
How you doing, champ?
How are
Good.
you? Can you say hi?
Yes, we're going to go ahead. We're going to get some lunch, and then we've got somebody coming in.
What
What
do you
time?
You guys didn't discuss the shape of the universe or the shape of the globe.
I know that, yeah, he read it to me. He read it to me when we did. But we'll come back on that one
Start
later.
with the smart guys.
You're the smart girl, so we'll get one out. All right.
So why are you
Probably, hi guys.
Hey, how are you?
Good, it's good to see everybody. Staying out of trouble?
No.
No? Hanging out with this one, I know, right? I knew who to blame. So, yeah, after lunch, we're looking at probably maybe 3:45.
I've got one coming at 3:45.
Okay, so 4:45 or 5:45?
4:45.
Yeah, we'll be here the rest of the night.
We'll be
We're doing 9 hours of CEUs with you guys.
Do you guys want coffee or food?
No, we got stuff. Thank you. But he's a sweetheart.
No, we got.
Too bad you didn't bring the boss with you.
He's coming tonight.
Oh, is he?
Yeah.
Oh, well, good. You didn't tell me that.
It's really, I have no one to annoy with you if you're not here, so.
You can annoy me whenever you
Well,
want.
that's what I came to do. That's
Right?
all
Yeah, but the posse has to keep you off
Oh,
now.
yeah. Okay, see you later.
All right, baby.
Okay.
All right, so what I'm gonna do is, he still has some tension in through here. Oh, and it's releasing. Do you feel that? Isn't that wild? So I was gonna whack this pretty good, but I'm not going to now. Yeah, that feels nice. Yeah, I'm gonna leave it alone. All right, so let's go ahead and flip you over, Anthony. You doing all right? Good. All right. Let's see what we got in here. Ooh. With all that we did, his head still swings this way. Let's see it. See it? I know. I was watching out for you.
Maybe the left shoulder chest too.
Yeah, it could be, but here's the thing. I'm always going to go ahead and get the occiput first. You know all the legendary people that will go ahead and set the occiput if the shoulder works better? Let's just set the occiput first, and we'll go after it. And let's see what it does in the shoulder. Maybe we could have checked it before. You get some love like you ain't had it in a while, bud.
I've been dust forever.
Oh,
Not good ones.
isn't that sad?
Students working on it.
All right, now, you see what I'm doing? Am I using standard contact? No, I use a different contact because this hand doesn't work like yours does. When I wave at you goodbye, bye, dude. So, sorry. All right, so we'll keep his head down in through here. That ring your bell? Look at that. See, Gabe? But his body's like, oh, what the fuck was that? Right? So now what I need to do is, because I didn't really focus on the occiput before, I want to see what his motion looks like. It doesn't look too bad, actually. Yeah. Nah, it doesn't look bad at all. Everything else is clear here, except right here. So, what I'm going to do is I'm going to come back to that. So I'm going to come back to it because I know that ties in with this rib up and through here. I'm going to go ahead and we're kind of doing a little out of sync, in this case. It's okay. It just shows the variations of how you can approach things, okay? It's not always the same thing every time. That doesn't feel bad. Is it sore?
A little sore.
Is it? Well, let's see this. Check his bicep tension. Bicep tension is pretty bad.
Partially tore that last year.
Yeah. And then you come in through here. There's your, feel that, pup? So that's not good. So the knot here that I typically go for, it's not there. But he's got the bicep tension, he has the other thing in through here as far as the brachialis tendon. So what else is going on? Right in there. So I'm going to go ahead and I'm going to adjust the elbow anyway. So what we're going to do, just like I showed you guys earlier, sometimes I'll use that lower drop because he's got longer arms, right? So I'm going to take this. It's going to feel weird, but you feel the pull, the rotation, feel the pressure. Okay. How's that feel?
Did you use a tool in your office?
I have drop table mechanism in the office for sure.
But I mean, this is not,
Use the hill, right?
I use it. Yeah.
just because I use the hill and it's so much
more cushion than this, so I wasn't sure if you have a
No, the
preference.
hill will work perfect. Actually, the hill drops are very similar to the Thule drops. They really are. All right, so we already know we got stuff going on here, so we're going to slide this in. Nice. Hang in there. Now, I'm pushing in here. I'm spreading this apart. You feel it, right? Ah, there you go. Now, here we go. Feel for the knot. Right there. Now, the interesting thing about this is you pull it out. So you're pulling away from the rib cage. You know, sometimes boobs get in the road though.
Those usually feel a little spicy. When you do those anterior ribs, just be careful what contact you're actually putting because they can be real tender.
Yeah.
So just be careful on your hand when you're doing
Now, I want you to see his lat. So he's got a big trigger point in here. So I'm going to hit that trigger point and up there.
There it goes.
Now, see how the lat is less engaged? He's got trigger point here. George, you want to come over here and grab that handle for me? So I'm going to have to get that trigger point here. This is chronic stuff. All right? And he knows it. He knew that was it. So I'm going to take this knuckle. And again, 2 knuckles. Now, see how that's starting to move better? Now, I'm at the AC joint, all right? So that doesn't feel very good. So I'm going to camel toe it. Okay? So, and you felt that whole thing drop into place. Now, I'm moving around.
Light.
Light.
Yeah.
Isn't that funny? That's what Liv said too.
Yeah.
Isn't that cool? Good. Yeah. Go ahead and raise both arms up now.
Yeah, I'm sure that's that before.
Right? So it's things like that. Are we going to get total correction? Not necessarily. Are we after total correction every time? Not in a contest. Not a contest. You know, in the office, we love that, all right? That's our goal, obviously, that's our goal. In contests, we want to function. So, come over through here. There, you got a big knot there. Do you guys want to feel that knot? Then you'll know, you'll go right to it, because you'll remember it. So, yeah, go right here. Take his hand just like this. Yeah. You feel that? Yeah. Feel it? I mean, it's just a big knot. It's one of those things that I think that you have to feel it, you know? And then when you feel it the next time, you go, oh, I know what to do with that. Yeah, switch your hands. No, the other way, hands under. There you go. And bend it here. Yeah, just like that. Feel that knot?
Okay.
Feel it?
Yeah.
Yeah? Yeah, that sucks. All right, so this one's going to suck a lot more than the other one, okay? So, you feel the pull, right? So, okay, come back over here and feel the knot, guys. Or feel where the knot was. And a lot of times that's going to be tender because that knot, isn't that cool? Yeah. That knot was protecting it. Now, what did I not do? Right? What is the thing that everyone hates when they go ahead and do that? Is that feeling of helplessness. So what I kind of created was a closed pack correction. So everything I do, if you think about it, is a closed packed treatment. Right? And some of the things that I'll show you in regards to like shoulder stabilization exercise, just super basic stuff. So I've got 2 things. One, I want to show you what I call my seated isoband treatment, and I want to show you my closed pack thoracic training. So super easy, super quick. It's better than trying to have it open and hurt yourself. You know what I mean? So, how you doing? Put this right here. Take this right in here. Collarbone. Now, back where they belong. Now he's restricting. Shocker. Put that on his forehead. Take this in through here. Take your knuckles or your thumb, whatever. Don't hurt yourself. What you're doing is this trigger point therapy, which technically you should be able to charge for. All right. Put it in there. Isn't that fun? Isn't that fun? I'm like a little kid. It's like, hey, did you see that? I'm gonna do it again. All right, so what we're gonna do now, I'm gonna take this, check his hips. Ooh. 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 Yeah, all right. See how far this knee goes. It's a little sticky. Somebody might be getting a crotch punch today. All right. He's like a lot away. So what we're going to do is, again, with guys, they got stuff in the road, right? So I always tell the guys, push your junk down below your pubic bone, all right? It's not already there. But I don't want any surprises. So, I know, right? So the pubic bone, like this. What you tell them is, okay, listen, your pubic bone maybe slid this way or this way. I want to check to see. So I'm going to do it with Liv. It's just the same way. Don't make it weird, okay? So you doing all right, home dog? Yeah. All right, so, and somebody's sore, aren't they? So there's the one side. Dude, seriously? This. But is it not weird how sore?
Hey, Ray, you did such a nice job, you didn't even Here, right short, right short. Horse right in there. Go, please. Right. Down here. Go into your knees. Yeah, well, that's fine. Yeah, the pressure, right? So here's the knot. Here's the knot. So I'm going to choke. Breathe the guy. So I do. You just open this side, right? So straight letters. So same time we here. Not blasting you right now, so I'm going to move. Isn't that cool? So let's take your nose through your right. Through your right. You want me to help you? Yeah. Hangers? Are you serious? Yeah. This is good. See? This side here? It's a bullish. So this is active. So this is front. All right. So you mark down. Sciatica? Yes. On left. So go back left. 2 foot. Right shoulder. Right shoulder, front or back? From here. Back here. So it's you. Umpire, yours. There you go. Good. Hey, how about 2 those? Okay. Yeah. That's away. 1. Happy. Good job. Good to see you. Good luck. What's up, Paco? How are you? I'm good. Good to see you, man. Good to see you too. Good to see you. Hey, and you're trying to help people out, right? Always. You gonna make it a world to get in the chair? No. I don't know if I'm going either. You really do. Me neither. You know? You think you're gonna go, but then you don't know. I want to do ASM as well, so we'll see. Yes, I would. I've never been to San Francisco. You? Sacramento. Oh, yeah, 2023. Oh, so you're got it. All right, ready? Go. It's always good to see you, man. Now, wonderful. Let me do that. Shoulders okay? And right. Oh, just like, that's it. Yeah, like, just a